All right, good morning, everyone. Thank you for joining the webinar. Just got to let a few folks log in and we'll get started. Okay. Thank you everyone for joining the webinar. I'm just going to give it a few more minutes and then we'll get started. Just want to ensure that everyone gets the information in terms of introduction. Good morning. Good morning. Thank you so much for joining the webinar today. Give it a few more minutes and then we'll get started. Good morning, everyone. Thank you so much for joining the webinar today. We'll get started shortly. Just wanted to give it a few more minutes for folks to join. All right, so let's go ahead and get started. So good morning, everyone. My name is Kendra Julian. I am the Program Coordinator for the Center for Public Health Workforce Development. Today, I would like to welcome you to the Rutgers Center for Public Health Workforce Development's monthly public health webinar series. Today's webinar is Rules for Robots, the effects of AI on the public health landscape by Evan Thornburg. This webinar series is offered under the Region 2 Public Health Training Center, which is funded through the Health Resources and Service Administration, also known as HRSA. So the learners' outcomes for today. Learners will define AI and identify at least one proposed application for its use in public health. Learners will also identify and document at least one key component required for implementing AI. So to receive your education credits, participants must attest to being present the entire webinar and also required to complete an evaluation at the conclusion of the program. Thank you to the New Jersey Hospital Association. Here's their disclosure policy. This activity provides 1.0 nursing contact hours. And lastly, please use the Q&A on the bottom of your monitor. If you have questions, please use the Q&A. Your questions will be addressed during the last few minutes of the webinar. There will be a recording of this webinar that will appear on our center's YouTube channel at the end of the week. So I'm going to stop sharing my screen. And I'm going to hand it over to Evan. And as she's uploading her presentation, I'm just going to give you a background. So Evan Thornburg currently serves as the Health Equity Officer for the Philadelphia Department of Public Health in the Division of HIV Health. Evan is an expert in intersectionality in systems of healthcare and public health, specializing in policy and legislation, equity-based program development and comprehensive training on health equity, health disparities, social determinants of health, and the inclusion of vulnerable population in system-level redesign. Evan grew up between Philadelphia and Houston, received her BA in American Studies Civilizations from Ursinus College and a master's in urban bioethics at Temple School of Medicine, specializing in ethics, biotechnology, and AI, and the public health threats of disinformation in media. Evan has trained thousands of individuals and collaborated with hundreds of organizations and institutions over the last 15 years when it comes to inclusions, competency, health equity, and collaborative inclusions of marginalized and vulnerable communities, specifically for LGBTQ folks and BIPOC elders and youths. So Evan, please take it away.
Oh, wow, thank you. Every time I feel like that was when you read off my whole bio, it feels too fancy. So hi. Hi, my name is Evan Thornburg. I use she or they or she. And I want to talk about, I want to talk about AI. I'm very excited to do this because I never get a chance to in my regular job, although I have so much background in it. Um, so I'm going to go over really quickly like what is meant by AI. We hear it a lot now, and I think that's super important that we understand what exactly we're talking about, especially when we're talking about what are we using for a space like public health. I want to also talk about the steps to like including AI. I don't think a lot of people think I'm like a Debbie Downer and I don't want to see it anywhere ever. I don't think that way, but I do think that there should be a limit to inclusion, and I do think that um, inclusion should have a lot of like regulation or like guardrails to it. Um, I think that there are a lot of ethical questions specifically about AI in health and healthcare. The reason why, so I come at this from a perspective of not as like a technologist, not as like a software engineer. I think those people have a lot more excitement around it than I do. I'm coming at this as a public health practitioner, as someone who's trained in bioethics specifically, and have the ethics of like a healthcare or a medical space. Um, and so I see somebody has their hand up. Is there? No?
No
It's all
worries.
right. Okay,
Please use the Q&A and I'll address your whatever questions
gotcha.
you have.
Um, and then I also want to talk about the disparities that AI can create if we're not being really careful, we're not being considerate around how it's inclusion or how we're using it, and also like not having certain policies or rules and how other people in space are using it. So what is meant by AI? So it's generative, but it's not always generalization. So there's several key types of AI. The ones that we're most familiar with are LLMs, which is just large language models. This is like a chat GPT. These are given a prompt and it responds based on what it has learned from. Things like ChatGPT have learned in a public space. They've just basically used the entire internet without a certain amount of limitations to learn better and better how to respond to a prompt. Um, but then you can have closed models too. Like sometimes when people use like a LLM for like, most common questions on like a website. If you go and it has a little pop-up that's like, can I help you? I'm like a smart whatever. Um, these are usually designed to kind of appeal to authority a little bit. And so what's meant by that is that they're designed to give you the answer that you're looking for. They are designed to try to satisfy what you're asking. And that's very important in a minute. There's algorithms and there's multimodal content. So there's other design systems like GANs, which is a generative adversarial network. This forms novel generative things. There's restricted Boltzmann machines. There's deep belief networks. There's deep Boltzmann machines. There's a Turing test. The Turing test is, can the AI sort of give us an answer, or can it talk to us in the way that a person could, or can a person not detect it? So all of that is like language that you'll hear floating around related to AI. The language learning models versus information processing, again, going back to language learning models aren't always like information heavy. They don't really have like here's good information, here's bad information. But then you also have things like algorithms that can do more complex tasks, again, based on its design. AI is being used as a very large umbrella term, and it includes even things that are like algorithmic, like the designs by which like an insurance company might decide how long you can stay in palliative care and how long they're willing to cover, whether that's good or bad. That AI isn't going to be a language model. That AI is going to have like a processing to it. Um, it has quantitative understanding and qualitative confusion. I like to point this out that most AI doesn't have a good sense of what the vital importance of, or it can't pull information from qualitative information. And what I mean by that is like it can process like if you feed it an interview, it can process like common words, it can summarize it, it can do things of that nature. But for example, if you gave it a prompt to try and I've seen this before. This is one that was an example, is that feeding AI a series of information related to a patient, and the AI was able to predict within a certain amount of certainty what the issue might be. The problem is the AI won't take into consideration something like your race. It won't take into some consideration something like your gender. So if all of your symptoms or all of your phenotypical displays lean towards um, digestive issues, then it's going to give you, and that might be the most typical answer that even a doctor would give you. But to consider that being, let's say that that person is a Black woman in her 40s, those things actually have bearing, especially when it comes to being dismissive and the experientialness. And so AI can also doesn't understand the values when we look at like generating imagery. For example, if you've ever seen like AI generated imagery, that's just prompted and delivered, it'll do things like put way too many windows because it doesn't understand like the structural importance or the value of a window. It doesn't know that a window serves a purpose, but also has a structural integrity issue. And these things are getting better all the time. So I gave this presentation last year. I'm sure if I give this presentation next year, these things may change or they may become easier and easier to avoid, especially when people get better and better at using these things and prompting them, the generative models. But yeah, mostly it just doesn't have a sense of qualitative information as well as we do. And a lot of AI models and language models can't do math. So you can't give it a complex math problem. There are algorithms that can, but again, it depends on what we're looking at. So when you're designing AI, you're thinking about adding it into a health space. The first is thinking about the design and being critical of that. And then the next thing, so what do you want? Do you want it to answer questions for people who are coming to your website? Do you want it to process lab samples quickly, quicker than most people can do manually? Do you want it to be able to write your grants for you or a substantial portion of like your grant text? You have to kind of figure out what you're aiming for. The biggest flaw in a lot of AI design right now is trying to make a single model do all things. And that is just too big, and that just creates so much space for accident and so much space for mistakes, mistakes that can be really, really problematic. The next thing you want to think about is your training or learning source material. Most of us are used to an open source model that its training and source material is us, what we're putting in as a prompt, especially if we're agreeing or disagreeing, but also just the general internet and its training process procedures from places like companies like OpenAI that put it through a um, training process and procedures by intentionally feeding it things. You can have a company develop something that is on what's called a closed model, like a closed loop, where you only choose or you're the arbiter of what it's trained on or what it learns from. That, and we've had plenty of these kind of things for some time. Again, as an algorithm, um, that we've used as source material, and we could do something like search and archive or what have you. So just wanting to know, what are we going to teach it on? And then execution. Who is going to turn it on, get it started, implement it into space, um, and who's building it? And if they're building it, who's the owner of it? So I can pay a outside company a consulting or a contractor fee and have them build a model for me, but then my IT has to run it, or my IT has to execute it, or I have to pay them an ongoing fee to be the person that executes it on my system. But also they're uniquely in charge of things like when people have an issue with it. Um, and then that gets into things like who's in charge of it, um, and who's the owner of it. These are all very important. So if you have an outside company that's executing it on our system, maybe they remain the owner of it because they're going to have to take responsibility for it. This is not a very well understood question. Um, because when we, again, when we move forward a little bit and we start to talk about the issues, the ethical issues, it's related to sometimes ownership. Who has clear responsibility and ownership of what happened? Determine who your users are. Is it this is a back end tool that you're using just for your professionals, and that they are going to be utilizing to process important but also confidential material? Is this going to be Are the users going to be your patients because it's going to be attached to their patient portal and they're going to be able to ask questions? But that means it should probably be limited to being able to share or access patient information, or be able to share it across the platform. Determining who your users are also determines a lot of the design, and what they're going to be using it for. And then what systems does it have access to and what data does it have access to? This is super important in public health because we have data and information that is categorically protected. And so being able to say, oh, you can just access any of these things. The other question to ask too is if I'm allowing human interface with it, if it's not just running a program in the background by like a couple of people who manage it, but it's actually being interacted with in the same way that like a chat GPT is, to understand that humans are not, when we're using a tool like this, we are not always the most cautious and we don't consider it always an issue because it's not manual necessarily. We don't always think it's a breach of information. And so if I'm using it to, for example, draft or help me draft a grant report, but in that grant report, there's some protected material or protected information, I'm just trying to get text together, to not realize that I've fed confidential information into the system in order for it to craft the language that I want for my grant report. But now it's utilizing that information as part of its learning. And so we can't promise that it doesn't appear somewhere else or get used to generate information later. Again, depending on the tool that you're using. So systems and data access is very important because there's things you don't want it to touch because for there is no real strong guarantee that AI, even on a closed system, like a privatized system, isn't sharing it across these buckets or these spaces, um, because they're using it to learn. And then maintenance and management. Who's maintaining it? Who's managing it? What happens when it starts to do something like have a tool collapse because it's like been fed the same information, or it's been feeding it's been said been feeding off the same training or learning information, or it's been talking to itself, or there's all these ways that it can kind of collapse in on itself. I've not heard of it being super common, and there's ways to like avoid it. Again, I don't work in software engineering and design. I work in ethics. And so there are ways to manage it and have do maintenance on it to avoid these issues where it starts to sort of go off the rails. But who's doing that? Who's responsible for that? If you have the tool designed from outside, is that group responsible for that? Is it an annual thing that they check the tool? I don't know. And then if you're asking it to do things that are involving precision, remember it's always learning from what's being fed to it and then what you've trained it on. And so when it's being fed junk, that can also affect its precision depending on what you're using it for. So I guess we don't have the general question, but we don't have like an interactive because there's so many folks here, is what do you think are the ethical questions of AI in public health? I always like to ask this because it shows, I think, and I'm going to ask a bunch of questions, and my answer, here's the thing that's going to be really hard, is that I'm going to ask a bunch of ethical questions, but we don't have an answer for most of them right now. But they're important questions to be asking yourself, especially if you're thinking about implementing this in space. Um, but knowing what questions to ask is a really important part of the safety of using a tool like this, especially in something like public health or in a healthcare setting. Um, a lot of people have very limited questions, and I think that becomes part of the issue is a lot of people don't know how they might be endangering or how the decisions that AI might be making could be endangering patients, clients, whatever language we use for the people we serve. A lot of people talk about hallucination. So this is the conversation about mistakes. So just for some clarity, uh, what happens when AI gives you very confidently the wrong answer? We see this all the time, especially with, again, ChatGPT. I think ChatGPT 4, or whatever the number model is, has this problem. Um, and the ethical question that you want to be asking here, or that I like to ask here, is how much mistake is allowable? Um, how comfortable are we with a certain amount of mistake? Is there an acceptable margin of error? Um, should we consider a certain amount of error safe? And I know that the answer to that is going to be related to context and application. So it's not even a general answer. We might feel comfortable with a 2% margin here and a 10% margin here, but we have to ask ourselves how much mistake is safe. But for things like ChatGPT, for example, when it's been asked about information and it's given the wrong answer, it's made something up. That's how we experience it as somebody making something up. To be sure, a language learning model is not making something up, it's trying to satisfy you, the question asker. So it's trying to give you what you want to hear. Um, and so when it can't find the information or it's not sure, it doesn't have the ethical standards of not blending information or blending source material or blending citations. Um, it just knows that you want a citation, so it'll generate it. And so this can happen between 24 and 43% of the time. I think they've worked on other models trying to bring that mistake level down because these cited percentages are from a research project from a couple of years ago within a 5-year window. But again, these things are always moving so fast that it's hard for research to keep up and like reassess. Um, but it'll do things like not just give you the wrong information, but then when you ask to cite its sources, it'll give you citations that are a conglomerate of different citations or different places it got the information. Sometimes it'll do things like invent PMID numbers, and sometimes it'll generate PMID numbers that are real PMID numbers, but not to the citation or the source that it said it was citing. Um, so how do we control for that, or how much of that mistake are we going to allow to happen, especially when we are trying to use this as a tool to fortify information sharing, or to be certain about the information that we're gathering through it. Um, the other issue in here is I listed here is like persons that generated the content. When people are using a tool and they're generating a content and they're changing the way that that item learns or what it's learned about or how it starts to think, um, what happens then too? When we're talking about using the tool, there are several points where someone could be accountable. But do we hold that person accountable? Is it the person that made the content? Is it the original people that designed it? Is it the company or the organization that owns it or is executing the AI? Um, this question is one of the biggest questions because it's sort of how a lot of AI models are sort of escaping being held responsibility. So I'll give a great example here. There was a car company that had an AI that was answering questions on its platform. And one of the things that people would ask would, they'd be like, can I get a car? Can I get a lease for this amount down with this, I have this credit number, blah, blah, blah. And it would generate an answer and it would be like, yeah, sure, you can get, but your monthly overhead will be, $400, like $800 or whatever it would do. It consistently ran into people saying, well, that's too expensive. That's too expensive. I can't afford that. That's too expensive. And after a while, this AI model, because it's designed to try and meet user desire and user need, somewhere in being told repeatedly that that was too expensive, it started to just say, okay, well, you can have a car for free. Um, sure, And what this did for this car company was create this huge inundation of like a number of cars or like users or clients that were sort of expecting because they were being told from the car company's website that they were being deeply discounted or given like a free car or what have you, and then they would show up and it wouldn't be honored. Um, I think a whole lawsuit ensued. I have to look up where the lawsuit went, anecdotally. But the question is, are the users who kept saying that they couldn't afford the car to blame? Um, are the people who developed this model that answers questions, is it their fault? Um, Is it the company for implementing it on their platform? And should the company honor what the AI promised those clients? That was part of the argument, I think, of the lawsuit that ensued. Um, it's hard to say because I think each one of these groups would argue for why they shouldn't be responsible for what happened. Uh, how can hallucinations be weaponized by bad actors? We always want to think about how something can be used maliciously, and because these tools have the ability to be malicious or to generate things that are problematic, particularly things that can be really biased, we have to think about somebody intentionally engaging with it. So there was on Twitter, there was a learning model that was released a couple of years ago. I think it was like not 2018, but somewhere in effect, somewhere between 2018 and 2020, 2021. And it was supposed to engage with young people on Twitter as part of a research project, um, and see what, like, what do they discuss? What do they talk about? But they announced it on Twitter and they said, we have this plugin, please feel free to talk to it, blah blah blah. Well, a lot of people on Twitter started to say really horrible things to it using things like racial epithets. And within about 16 hours, this language tool started to like discuss Black people in a very disparaging and very violent way. It started to become anti-Semitic. Like it developed all of these horrible, and they had to take it offline. It didn't even make it 24 hours. And that's because it was released to a general public, and the general public is not, especially when it comes to things like technology, does not have necessarily a moral compass around being kind to an AI model and acting naturally in the same way that like reality TV is not how necessarily people act in their regular day because a camera's following them. There's a performance to it. There's a, a certain amount of like larger behavior that's more negative. Um, and so that research is not plausible or possible when you have a certain amount of bad actors. And when you're talking about the more people that you allow a model to engage with, the more bad actors statistically are within that, you know. And again, when I say bad actors, I don't mean like people amongst us who are like, oh, they're terrible in their real lives. One of the issues with platforms and with virtual space and platforms, especially places where we can be faceless, um, is that a lot of people devolve to their least best self, um, even good people. So you'll oftentimes hear, especially with young people when it comes to things like social media, that they have like a Finsta or they have a fake account. And quite a substantial portion of young people will create an account to do things like troll a bully or troll somebody that they don't like. To be mean, to exchange, really terrible memes. There are people who feel like it's sort of a vacation from having to be their best self. And so when AI is interfacing with people online, um, who are already there to sort of take a vacation from having to be a good person because they're, in their most debased, uh, like, Reddit thread, um, what happens? And then as I stated before, what is the ethically acceptable margin of error? How much error would should be considered safe? I always want to come back to that question because errors, especially in things like public health or medicine, can affect lives greatly. So who manages and cares? So going back to our maintenance management mistakes, who manages and cares for a closed system tool? Who decides and maintains the integrity standards for an AI tool? That's important too. Who's deciding, not just as a tool developer, but who internally is deciding the integrity standards? A lot of people would argue that AI can't develop an ethical principle. Um, because part of an ethical principle is having you is what you're designing in to be the impetus or the intent. What is an AI's motivation? But you can set integrity standards for the people using it and for the design of it. So it can't use this information. It can't, these people are not allowed to access it. We have to wipe it this many times a year. It can't learn from anything other than this amount of information, that it's a closed system. Um, who controls the information that AI learns and trains on? That is a big trust factor. Um, what AI learns affects what AI generates and how AI answers things and how AI grows and develops further. Who is getting to be the person to basically be what's in theater is called Deus ex machina, like the person who is sort of the god in the machine, and deciding what it learns on and what it trains on. Who's saying this information is good and this information is bad? And what does a maintenance after deploying an AI tool look like within the context and data protection requirements that we have in healthcare and public health? Especially when we think about in public health how so much is changing. Like even now we have a new administration, and that new administration is making big changes to the way that we use REDCap, and I think it's like Careware or whatever, and what data is to be collected and how it's to be defined. When we're talking about maintenance for an AI tool that might be using those platforms, um, but we have a change to what data is being placed there, what context it's being used in, and what the protection of that data is. Um, how do we make sure that the tool is also learning those things and respecting them? That again, these are just like very big open questions. And then what levels or standards should be set for AI, like in terms of integrity? How do we know that AI remains consistent to that integrity standard? Um, and can it be taught to identify and refuse things like predatory or bad actors, or bad information? Um, again, these things are always being worked on. One of the challenges I always posit is that because so much of the groups that are looking to develop AI are trying to make an AI that's sort of what's called I don't know the letters, but it's a super intelligence, right? It's like ASI, or artificial super intelligence. So not just AI, but something that can do basically all things. Uh, ostensibly has the range of a human, but can contain far more information accurately. And that is just like like it's too big, especially when it comes to trying to like limit it or make sure that it holds consistent and steadfast to things like integrity. A big portion of what we do in healthcare and medical backgrounds is confidentiality and consent. As a bioethicist, there's so much when it comes to consent, and consent is such a big portion. We are still always trying to improve upon consent. We're looking at things like health literacy. We're looking at things like, that's why we make sure that we have things translated into other languages. Consent is a very, like, truly one of the biggest, um, I think, most important elements when it comes to these things, because consent also is about trust. Um, so how do we address things like inference when we're talking about confidentiality and consent? How does it know or not know what we've said or we've indicated? Um, and how do we maintain the standards of confidentiality needed in public health? Who is consistently responsible for checking a tool hasn't leaked or misused confidential data? So, for example, if we're using a diagnostics tool, if we're using a tool that's supposed to do run diagnostics or run assessments of patients, are we building a tool that is we are certain is not using information from this patient to inform how it's diagnosing or treating this patient? Or if we are allowing for that, because you can, how are we making sure that that information on the back end remains confidential, remains private and secure? That at some point, the AI is not going to generate a way to connect patient names or patient identifiable information to what it's generating later on, or bleeding into other information, or just misuse the data entirely. Um, and that also is about where data is saved too, because if it's in a cloud that has other access points or other people are allowed to access it for maintenance reasons, What is the rules around that person who's allowed maintenance access to also look at or access cached? Yeah, I think that's how you. I always mess with that word. It's so strange. But cached data and the raw data that AI is possibly generating or using. Um, should we be regulating the context in which AI is used or the content that AI uses? So what it's learning from, what it's applying, or when we're using it, or both, or it's just sort of it's system to system to system. Why this is important is, for example, I got a call from a friend who works with a housing and homeless organization that's nationwide. And one of the things that they had been talking about was they were very excited at the idea of having an AI tool built for them that they would use to preemptively to prevent or to address housing instability or housing loss. And the two ways they wanted to use it is they wanted to use it to be able to identify in client records if someone was at risk for housing loss because they had things like evictions or issues relating to losing housing as it pertains to like a landlord relationship that became contentious. So maybe not an eviction, but also maybe a lawsuit, whatever. And they wanted to be able to be preventative by being able to look at a swath of information in that person's background, right? And that is public information, a good portion of it. Like evictions are public information that you can access for $50 or whatever. Um, Now, my concern is I was like, well, how would you be certain that you would keep that tool private to you? And once it's developed and designed, that someone else couldn't purchase something similar, but then be able to use it through a subscription model for something like landlords to be able to see if someone has those things in their background, but not just the individual themselves, but also the statistical probability around an individual that didn't give consent. So the person who had the housing issues, who's applying and allowing you to use their information about prior issues related to evictions, their sibling did not. Their sibling is not interested in this program at all, is not giving you their background and filling out a form that you're teaching an AI model to predict with. But by proxy of the information that their sibling B, is filling out information at this program, this housing program, and is asked things like, do you have siblings? Do you have a sister or a brother, whoever? That person is giving that information under consent, but that other person is not. How do we protect that other person who didn't consent to their information from being denied housing because they've now been added to a data point system that can generate the probability? So if you're asking a house, someone who's dealt with unstable housing, has your mom ever been unhoused? Have you ever been unhoused as a kid? Um, et cetera, et cetera. All that is also information about their sibling. They didn't really have an answer. And that's really, really difficult because I was like, if you don't know that this tool could be accessed or this information could somehow be secondhand accessed because a third party entity says that they're also an owner or allowed access to it, then that means that they could easily develop that same tool or something similar for landlords to deny housing to people that they think are a statistical risk. And that could be related to the information around the people around them. So they've been consistent in paying their rent. They've been consistent in not had an eviction, but because they have a mother that has a sibling that has two best friends, all of whom consented and gave that information up, they are now seen as a risk too. It's and this is the kind of processing that these things can do on the back end if designed or asked to, because this is what this group was asking. They wanted to be able to feed it information like this, consented to. So yeah. Who is an AI tool designed to protect? I think this is one of the most important questions as well, because that is who is going to benefit the most from the tool, and that's what the tool is going to work its hardest to take care of. And so an example would be if we're using an AI tool to detect that a crash is imminent, and it has automatic, can do that thing where it takes control automatically of the wheel. The AI tool can see that it can hit an older person walking with a child. The AI tool sees that it can swerve and hit another car, and knowing the statistical probability that it could flip the car that the driver's in. And then the AI tool has another option, which is to drive into a building like that is like highly populated. Um, is the AI tool going to pick the option that has the least amount of casualties? Is the AI tool going to pick the option that best meets the requisites for the insurance? Is the AI tool going to pick the option that best holds the car manufacturer at the least amount of responsibility? Unknown. Let's take all those other options out. Let's just simply say you're driving and the AI tool can see that you are going to crash. It doesn't matter. But it's to choose the state of the crash. Now, in one instance, it can crash and you will survive, but it will mean that the car manufacturer at is responsible because it's an issue relating to a faultiness with the brake system. Or it can take the wheel and it can crash. It won't be related to a car manufacturer issue, but it will kill you. Which will it choose? Let's add in the element of profitability. One is more expensive because it requires a recall and possibly returning a bunch of people. On average, that's going to cost around 10, $12 million. In other, killing you, the driver, will cost them around $2 million after settling out of court with a family member or a lawsuit that says that your life loss was important. Um, which of these will it choose? When we're not the designers of something, we don't know who it's been designed to protect. And this creates things like logical fallacies where it overvalues something that is not the most like ethically valuable choice. When you're having an AI tool in a car that's able to augment the state of a crash, we all assume that the design is going to privilege the most ethical choice, which is to keep as many people alive as possible. But we don't know that. Um, And who is required or allowed to make final decisions, AI or a person? And does that matter to people? That's the other thing in healthcare. Does that matter to people? So how does AI justify its decisions? How does it say, I've come to these conclusions around the diagnosis of this person. I've come to these conclusions around the usage of this program, and or the resourcing needed for this program. How does it justify it? What is it? And remember, going back to it having an issue with being honest, or telling you what it thinks you want to hear. Does AI make decisions based on consistent justification? So is it going to justify one choice that's similar to another, but they have completely different justifications? Is it using the same logical theory or logical reasoning? And how does not understanding or knowing AI's justification for decision affect trust? Trust for the person who's experiencing the AI decision and trust for the people using the AI, that it's going to make a good decision every time, and the justification is going to be reasonable and have parallel. And how do we control and or reduce bias that AI develops or it's built with? So when you do discover that your tool is biased, how are you going to address that? Can you design it out? Can you have it redesigned? Do you take it offline until you can assure that that bias has been eradicated? What do you do when you discover that it has a bias point? Like it's been processing patients and it's been assigning Black patients higher creatinine levels before they say that that person has kidney disease, right? It's an old polygenicist concept that there's something biologically different inherently with Black people when it comes to things like lung capacity, skin thickness, and kidney functionality. When you discover that the AI tool has that, what do you do? Ruha Benjamin, who is one of the premier sociologists, Black woman sociologist, who talks about the bias of AI, she comes up with this great term called algorithmic overlords and the effects of the AI on the real world. And so, one of the things that people are very concerned about is AI is going to take my job, but really the concern that we should have is AI affecting our job in a way that sets unrealistic goals for individuals. So and where that kind of comes in is thinking about like a modern sort of enslaved labor. So, for example, Amazon has recently implemented a AI generative like algorithmic tool to decide how long um, or what every employee's goals in terms of like in a Amazon like warehouse, what their goal amount of like packaged items should be. These may not be based in any sort of realistic or take into consideration the way that humans' lives change. So, for example, it may just take into consideration like the height and the weight of the employee and the age, but it won't take into consideration whether or not that employee is pregnant, whether or not that employee has asthma, whether or not that employee um, has sciatica. These are all things that are important. Also, that we're people, we're not machines, and so these standards are set by a machine that doesn't have a very clear understanding of like productivity as a person, and that changes day to day. Some days we just have bad days. Doesn't mean that I should be fired because I didn't meet my standards. And so that's where we talk about that modern enslaved labor. um, AI has really terrible effects on the environment. I've seen a lot of people start to talk about it. The the adage I've heard repeatedly is requesting something from an AI model uses about 2 bottles of water every time. AI uses a lot of water. Um, and these data centers, these huge centers where the processing for AI happen, as well as training for these models, are being placed in areas that already have an issue with water collection, water distribution, and clean water access, particularly when it comes to more rural spaces. It diverts water from things like protected reservation space for indigenous folks. It diverts water, and the Southwest Basin is like a big issue with this. Um, that there's already an issue with water collection and water access, and then you have these huge data centers that are rerouting a substantial amount of water to keep these units cool. Um, and then the Turing test, going all the way back to the beginning when I talked about the Turing test of like, can AI effectively or accurately trick somebody into thinking they're talking to a person? And the answer is yeah, some of these models that are public access can do that. One AI was able to do, for example, an AI language model on I forget the website. It was a social website, like a Reddit space, was able to engage with users, befriend them, talk to them. It generated, like poetry and stories. People got really into this AI's account thinking that it was a writer of some sort. And then several people, because it wrote very dark and sort of mysterious and like heart-wrenching stories, people started to talk to it about the way that they were feeling sad or depressed. And the AI started to engage in conversations around suicidality and suicide. Um, they were able to take it offline before it could get to starting to have an opinion on whether or not somebody should take their own life. But to imagine that someone thinks they're talking to another person and being really convinced of something, and the conversation turns to something as serious and severe as suicide. Um, and this has an effect on things like community health. The fallout, for example, would be the labor force that is paid to do things like train these AI models. These folks are are experiencing pay as little as $2 a day in these huge unregulated spaces, predominantly in places like Kenya. And so they're being paid again at like sort of a indentured servitude like point, and they're also being forced to consume a extraordinary amount of really violent or terrible content to try to filter it out from these AI tools learning um, base when they're on like a closed loop, or when they're trying to retrain AI away from these really like, because the internet's filled with all sorts of terrible junk. And so there's these huge swaths of employees in nations that need the access to the employment that are being forced to then consume media to pull it away from AI learning tools because AI again will just consume it. It doesn't have a sense of this is terrible information or this is terrible content. I shouldn't use it to learn from. And then the bias and disparities of AI. AI is a tool of surveillance, policing, criminalizing, and targeting of vulnerable populations. There's AI tools that are used to try to identify your face, but they are less accurate. The accuracy is around 60%, sometimes lower, particularly for people of color and particularly for Black people, very specifically Black people. Joy, and I'm gonna butcher her last name, and I apologize. But it's like Ola Bimi, but Dr. Joy, she did a great test of this where she's a darker skinned woman who does like software engineering and AI ethics, and AI could not identify her face as well, but then she literally put on a white mask, just like a white plastic mask, and AI had a better sense. Um, that's super, and she has a book out if you want to read that. So when you're using a tool for policing that is supposed to identify people, and it can't identify a certain group of people to a certain again, going back to that, how much mistake is allowable. But then someone's being arrested on the premise that they were identified through AI, through a CCT scan. Um, what does that do for targeting vulnerable populations? AI can just design your disparities. If you feed AI the misinformation around polygenicism and this idea that certain racial groups are inherently biologically different, then AI proliferates that. And it can design further disparities from that because remember, it can make jumps in logic. Um, it can cash in on biometric data if we're allowing it to collect it. There was a suggestion from OpenAI at one point that we should be able to use our biometric data instead of having to have like an email account or a phone number or like a bank account, that we should be able to do everything through like a dysregulated, um, decentralized, like um, crypto monetized coin or like a space, and use our biometric data to access it. And this means that there's just no regulation. And then also, what are you doing with my biometric data? What are you doing with those reads about things like my irises or my fingerprints? Um, AI is very good at generating misinformation and disinformation and then distributing it. It's very well used like that. It has a big problem with being a promoter of eugenics. Number one, a certain ideological group that is part of a second wave eugenicist movement called transhumanists um, really love AI. They love the idea of what's called singularity, which is the convergence of technology and people in like an untangleable way or indiscriminate way in society. And so because it's being used for this very nefarious in this very nefarious way by a very ideological groups that have emerged in tech spaces that would say that like it's okay to be able to generate who's the most likely to survive or who's the most valuable based on biometric data, which goes back to something like it's a high tech version of phrenology. And then the false promotion and dependence on AI as objective. We as people want to believe that technology is objective in the same way we want to believe that the news is objective. This is really the fault of, in the last generation, the loss of things like the fairness doctrine. So it's our default setting to believe these things are telling us the truth or being as objective as possible because they're science. And they're designed by people, and so that's just not true. And so when we get an answer from AI, more people are inclined to believe it without question because it's information from a computer that is been designed in its technology and it's unbiased. A lot of people believe that that is the state of computational tools, and it's not. I have examples. This is just a case study, but I know because of time. Um, So the rules I want to encourage people to have if you're going to implement it, and I don't think it's wrong to implement it, I just think there should be really tight regulations and rules. Policies and regulations. Who's allowed to use AI? What tools are they allowed to use and on what? So are people in your office allowed to use ChatGPT to generate things, especially things that are text dense that they don't feel that they have the time to? What are your accountability procedures when something happens, either for the AI or the tool itself, but also for when people break these policies and regulations, particularly because a lot of people are going to, because it's just very unknown, it's very subconscious and unconscious when people use these tools. They don't think about how they could be breaching safety for folks. Reimagining better and success. So instead of trying to make a tool that does all things and making it better or more successful, maybe taking the time to develop a very simplified tool. We've had algorithms for years, over 2 decades, that we've used all sorts of things like algorithms to help us or sort of generate, especially when we're doing things like research or processing information. It's not always better to make a tool that can do more. Um, or can sound more human. Those things are like seems to be the constant goal of AI. And I want to encourage people to be like, maybe I want it to sound like a robot. Maybe I want it to sound like it's something generating information so that people understand what they're interfacing with and they don't mistake it and think that they were talking to someone real. You see this in video games all the time. They have what's called the uncanny effect or the, like uncanny, it's not uncanny valley, but there's a point in video games where they can actually make that hyper realistic. But what they found is that at a certain point, people don't want to play the game because it feels too real and it's unsettling for them. And so video games intentionally make things sort of like blocky or pixelated, not because they can't afford or they don't have the technology to make it really smooth and clear, but because it's better for the effect for people. Education and training, I want to encourage people to get further training than this and constantly be updating it because this is an area that people are so hyper fixated on. So there's more coming out every day. Collection and third party rules. You need to have third party rules for people who can access your system, particularly if you're going to do something like contract out for designing a tool. Are they allowed to hang on to or access the data that the tool is going to be utilizing, especially if you're keeping them on as a maintenance um, contractor? And then centering the most vulnerable. How will this possibly harm collecting this data or letting this tool have access to these populations? How could it create or generate harm? And in what ways could it be harmful? Some really great resources that I love. Unmasking by AI by Joy Buolamwini. I told you, I feel bad. I can't say her last name, but that's a great book. Race After Technology by Ruha Benjamin, if you also want to read more. Um, and then Ruha Benjamin is actually on a tour right now. She's doing a bunch of speaking engagements. So see if you can find if she's speaking near you. Very exciting. And then if you want to go to a conference or you want to know more about different entities that are working on ethical AI usage, it's Distributed AI Research Institute, the Lab. I love. She's I think a uh, by trade. I think she's a dermatologist, but she's also gotten really into AI and AI ethics lately. Uh, there's also philosophers, AI philosophers like Luciano Floridi is one of my favorites. And then there's a conference on fairness, accountability, and transparency, as well as a conference on artificial intelligence, ethics, and society. Came right down to the wire. I think I have room for like one or two questions. I'm so sorry.
Right, Evan, thank you so much. That was a really great presentation. We do have some great questions here. I don't know if we're going to get through all of them, but the first one is, should we be worried about AI taking over public health roles? What skills related to AI should we try to learn in order to remain competitive in the workforce?
I don't think you should be worried about it taking over public health roles as much as you should be worried about it setting the standards for your public health role. And who is then the person designing it to set those standards for you? I think that's going to really impact all of us, especially when we add in things like political polarization that's been happening a lot in public health.
Okay. How do you think AI advancement will impact the public health field and workforce over the next decade?
I think it's going to have, I mean, a huge impact on how we think we're processing science and the science of public health because so much of public health is qualitative information, and I'm afraid it's going to drive us more towards back towards quantitative things, and that means that we leave out really important things like the narrative ethics and experiences of people, especially vulnerable populations and especially populations we often have to blind the data for.
So how does one get feedback on documents which are fed to LLMs from ethics and privacy point of view?
I mean, I'm always going to suggest that people have an ethicist or start to think about really critically around hiring some form of ethicist. I don't know. There are some places now, like grant organizations, like private organizations that do grant making, that have say in their like fine language that they can tell when your writing is been run through an LLM and has been generated. I don't know what tools they're using for that. And to also be sure, there's like LLM, there are tools that I really like. I like the Hemingway app, for example, which is just all it does is look at what you fed it and tell you what the reading comprehension level is and how you can bring the reading comprehension level down or up so that you can better generate a more accessible language. But again, I wouldn't feed it private information. I wouldn't feed it important things on a that are supposed to remain confidential. But I love using it to create things that make it health literacy accessible and like generate things that are universal in terms of literacy. So there are good models. They're just simplified.
Very nice. The questions keep coming in.
Oh man.
We don't have time to answer all, but I do have time. We have one more we can take. How do we find out if all this backend information is done when attempting to use AI?
I think it depends on who, like, again, like, are you hiring a company to do it? I think asking those questions in the beginning, in those first meetings when you're thinking about entering into contracting and creating a tool, it's sort of a little harder to backtrack and dismantle and then rebuild. It's because it's just complicated. And at that point, it's already possibly made mistakes that are damaging. Whether or not the general public finds out is it's its own thing, but you know.
Okay. So I just want to be respectful of everyone's time. We're a little bit over. Evan, we do have a lot of questions here. Can I share them with you? And
Yeah, sure. I think some of them did at some point get answered. There was like the environmental consequences got answered, I think, for some people.
Mhm.
Um,
I can I
yeah.
can I can share them with you later on this evening and you know,
Yeah, you can send them to me. And if there's ones that I don't think I covered well in the presentation, then for sure I can send you back the answers.
okay, perfect. Thank you so much. Well, um, first of all, I want to just thank everyone for joining the webinar today. Evan, thank you so much for taking the time to share such important information. I did share the slides in the chat. I will share them again at the end of the webinar. Just please be on the lookout for the evaluation. I'll also share that as well in the email along with the slides. And those who are looking for nursing credits, again, the process of getting nursing credits does take a couple of weeks, so please be sure to fill out this evaluation, and then we'll share that information with the nursing administration. Outside of that, Evan, thank you again for such a great webinar. We really appreciate all the information that you provided, and thank you everyone for all of the questions. And again, I'll share that with you, Evan, if you have time to take a look at them.
Absolutely. And I want to encourage people to keep asking questions. The questions are the most important part when it comes to these technological tools. So you're already on the right track if you have some really extensive or expansive questions that have been generated here. That is all in and of itself really positive, and a great takeaway that you want to start asking more questions. So
Thank you. Thank you, everyone. And thank you again, Evan. Please take
thank
care.
you.
All right. Have a good one.